So what we're doing today is we're having an examination of this gentleman in front of me, and we've had a little bit of an observation actually when he came in. His skin is slightly red, looking slightly rosacea-like. Hasn't been formally diagnosed as that, but that's straight away a sign of what we could potentially be seeing down the slit lamp. And if we look at the images in a few moments that I'm going to take and what I'm seeing down the slit lamp as well, we can see there's new vessels that are growing there. Look down. Look down for me, please. Thank you. And you can see around the lid margins, there's definite signs of Demodex there. And from underneath as well, you can see there's a lot of inflammation around the opening of the meibomian glands. And there's a lot of biofilm at the very base of the lashes. If you look up for me, please. And again, we're seeing a similar kind of pattern on the lower lid margin. It's interesting to see the meibomian gland ducts looking quite straight, but actually a little bit wide as well, suggesting that the meibum is thickening within the ducts. You can actually see there's a bit of gland loss there as well, pretty minimal. On the lower lid margin. And the bulbar conjunctiva has pinguicula on there as well. So effectively we've had a white light examination on diffuse of the patient's eyes, and we can see definitely there's quite a lot of detritus around the eyelashes. You see there's Demodex there for sure, and in that detritus is actually, or the biofilm if you like, is actually where the Demodex lay their eggs. So if we NuLids that away, if we exfoliate that away, and that's not a new procedure, it's actually been around since the 60s, it's only now we've got to able to do it a lot more comfortably with this little gizmo, then we can actually break that cycle of Demodex hatching. So let's start. So I always find it's really useful to show the patient how NuLids is going to feel, so that they're not completely, first time is actually around their eyes, because that can be quite alarming. So that's actually how it would feel for you. All right, so okay, so there's little sterile tips. As I said, they go into the recycling, and we don't want to put that straight onto naked skin. So we're actually going to put something on there that's a bit of a lubricant, and I tend to use something that is going to be useful for the eye as well. If we think about the fact this gentleman has got definite signs of Demodex, something like a ZocuShield would be really good, because it starts combating that from an anti-inflammatory aspect point of view. And you can see straight away there were quite a few vessels, it was quite inflamed, so this is definitely going to be quite useful in that mode. So you're just going to feel apply a little bit of gel. And we're going to do the same to the other eye, so this can be working on the left eye while I'm applying to the right. Okay, so I'm going to tip your head up for me, please. Keeping your eyes closed and keep looking down to the floor. This is how it feels, okay? Keep looking down to the floor and keep your eyes closed, okay? So you can see here I'm going underneath the lid and the lashes, because I really want to get that biofilm off the underside as well. Really break that down. Okay, I'm just going to tip the chin up a little bit, and with your eyes closed, again, if you want to look up to the ceiling. Okay, so that's it, there has gone upwards. So just for the patient's comfort, we're getting them to keep their eyes closed. Some of my patients actually do this with their eyes opened as well, so kind of whatever you feel is going to be right for them. So as you can see, this is definite debridement, that's what you're doing. And if you think about it historically, we used to do this with that golf scrub. So this is a lot kinder and a lot more efficient. Okay, so what we normally do at this stage is just have a look and see how well everything has been removed. So let's have a look at that. So you can see there straight away, even though it's better, there's still quite a bit there. And that's exactly what we're expecting because this has been in place for quite a long time. So at this instant, what we're going to do is we're going to go back and do a little more to try and really remove more of that debris. But quite a lot has gone. You can see there's only about 20–25% left. Well done. All right, let's just, you can see straight away, apart from the little bubbles there, that actually that's much, much cleaner. So I'm just going to clean that up a little bit so you can actually see better on the slit lamp. Sit back for me. That's so much better. Keep looking down for me, please. So we can see that is definitely way clearer. You've just got a tiny bit there, but this has been there for such a long time. And normally with somebody like this, what we would be doing is getting them back in to have another clean, because it's that heavy. But we have made quite a difference to that, so that's really good.